The first step in solving any problem is recognizing there is one. Self-management programs for chronic disease are well-intentioned, but often fall short of member engagement and return on investment for payers. One healthcare maverick founded a unique solution to these challenges. She raised $12 million in funding and created a national care network carrying more than 60 million lives. It has growing payer endorsement and a unique technology and delivery model. Brenda Schmidt, CEO of Solera Health. She's with us today on Red Hot Healthcare. Let's go.
3 along at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Brenda Schmidt is the CEO for Solera Health, an identification, prevention, and management network for chronic disease. Their technology smartly matches members with best-in-class network partners and community organizations to deliver services resulting in better outcomes, lower care costs, and greater member control for their quality of life. She served in several prior positions, each more than a decade in length. First, CEO of Viridian Health, and before that as Director for Global Marketing at Baxter. Brenda, welcome to Red Hot Healthcare.
Hi, Steve. Happy to be here, and thanks for having me on the show.
We're going to get into Solera, its technology and solution delivery, but I'd like to have our audience learn a little bit more about your background, Brenda.
Well, at my heart, I'm a science and data geek. My education is actually in microbiology and a master's in immunology, but transferred from that into spending 15 years at Baxter Healthcare, primarily in the clinical nutrition division, in a variety of roles in product development, global marketing, management, quality. And the last 6 years I spent in Latin America building the clinical nutrition market through developing multidisciplinary nutrition classes. But I had 3 kids and I was spending 60 or 70% of my time in Latin America and was really looking for an opportunity to leverage the experience I had in nutrition and health behavior change and the fact I was bilingual to really understand how I could make an impact in the health management market in the U.S. So I started a company in 2005 as the market was really going high-tech, high-reach. Our model was really different. We approached organizations that had very diverse employee populations. We really felt that a high-touch, personal approach was needed to move the needle on behavior change for folks who may have health or literacy challenges, required cultural competency, or language specificity in the programs that were being delivered. And then in 2011, based on our successful outcomes in reaching and changing the behavior in these employee populations, we won an $8 million Centers for Disease Control contract as a demonstration project in population health. And that program was Solera sending our folks into communities and establishing and educating small and mid-sized employers in these communities on evidence-based health promotion practices, and then convening community leaders and building capacity among community organizations to deliver evidence-based chronic disease prevention and management programs. So now we had a really good view and understanding of employer health management and the tremendous capacity for community organizations to impact community and individual health. And those experiences really shaped our view of what was needed in the marketplace and ultimately what we developed with Solera.
When I looked at your efforts with Solera and what it is and what it's becoming, it reminds me a little bit of the movie The Usual Suspects. And I'm sure most of our audience has seen that movie, where at the end, the police detective steps back. He looks at the entire bulletin board, to figure out who Kaiser Sose really is, or who has been the whole time, and what's been eluding him. One of the things I find interesting about Solera is, rather than being another player in what I see as a heavily commoditized chronic disease self-management vertical, it seems that you step back to cast a wider net, as it were, and make Solera an actual network for all these commoditized players, maybe best in breed. And then what you did was you also added in better analytics, better technology, certainly more capital, and also brought in payer relationship leverage, a lot of what's missing in these individual players. Do I have this right in terms of my understanding?
That's exactly right. There are a lot of organizations in the chronic disease prevention and management space looking to make incremental improvements. And the payers and the providers and the consumers and the community organizations were really clear and powerful that they wanted to cover these programs, that they saw the opportunity for community organizations to make a real impact. But there wasn't this integrator role associated with connecting all of those pieces. And even as early as 2010 and 2011, there were a lot of published studies talking about the opportunity and almost necessity for an integrator role. As we saw the literature coming out and the opportunity for it, there was a lot of interest in the model, but no one had ever operationalized it. And that's what we saw as the opportunity, is the pivot to operationalize an integrator role that would leverage community resources and more recently digital providers into a high access, lower cost network as an adjunct to primary care. And when we saw that and talked to these stakeholders across the industry, it started to emerge the benefits across a very diverse ecosystem. So for the payer, they wanted one contract with an organization that could meet their compliance and data and privacy security requirements at a single price point that would offer their members choice to access a very wide, diverse network of these chronic disease prevention and management programs. They also didn't want to spend the time and resources to evaluate all of the new market digital technologies to see which one was the best, especially since there are new digital technology entrants into the space literally almost every week. So they looked to us to say, how could we drive member choice, roll-up reporting, a single contracting, a single revenue cycle management, a single person to pay for their members to access a very wide ecosystem and diverse network of service delivery partners. The other interesting thing that it did is it really redefined the relationship between the payer and the physician, because in a lot of instances, I would say a very large percentage of people who go to their doctor, the physician's advice is lose a few pounds, eat better, exercise more. And they send those patients out into a world where that's not very easy and it's not paid for. And so the payers now can go into their physicians and say, gosh, we're now covering a program at 100% as a preventative benefit for your patients to do exactly what you're asking them to do. So there's a huge benefit for the provider. And then for the consumer, they get member choice. They get to pick. And that's not something they hear very often from their health plan. And then for the community-based organizations and digital providers, they get to do what they do best. They get to connect as a trusted resource in their community, and they get to deliver the program. And they don't have to worry about all of the back office technology, compliance, infrastructure that they would need to build to support being truly integrated into healthcare. Most of the organizations in our network are non-clinical, non-licensed, non-credentialed, truly community organizations.
This concept of including community-based organizations into the mix, into delivering the management programs and delivering them effectively, I know that that this is new to the industry. I also know that there's a certain advantage to doing this. And I don't want to steal too much of your thunder, but I'd be remiss if I didn't bring up this point that you have this mantra about getting management programs into all facets of lives to get better results. So maybe you can touch on that a little bit more.
The challenge for any health behavior change program, whether it's chronic disease prevention or management, are getting folks engaged. And when you think about consumer engagement, we have to make these programs almost get in the way. And I like to say we need to meet people where they are, where they live, work, play, and pray. And if we implement these programs where it's convenient and where people already are, and places like churches where they already have a social support network, they're much more likely to be successful and people are much more likely to engage. And for a long time, community organizations have been hugely impactful in how to roll in healthcare. They just haven't been integrated with healthcare. So most of these organizations have been delivering evidence-based programs for a long time, but they've been grant funded. And when the grant ends, program ends, and it's really criminal because the outcomes from these programs are really significant. And so the challenge was, how do we take all of the best practices and ability to engage community members and provide high impact programs integrated into healthcare? So we have hundreds of community organizations in our network and thousands of delivery sites, and we're growing that all of the time. Our goal is to have a community delivery site within 5 miles of 90% of the population, because we now also have about 12 digital partners. And there's a lot of conversation about digital partners allowing for scale. And they absolutely do, but scale doesn't matter unless you get people in the door. And across any demographic that we've seen so far with our program, half the people choose community and half the people choose digital. Folks want to select the program that meets their unique needs and preferences. Like, do I need flexibility? Do I want to have a group, or do I want to participate individually? Do I like text messaging, or do I want to do it on my phone? And those subtle differences in how those consumers are engaging makes a big difference. And I think that's a really important way that we view the market. There's a lot of discussion around patient engagement. How do we get patients engaged? And we look at it very differently. We think consumers are extremely engaged in their health, but we don't make it very easy to be engaged in healthcare. So how are we treating patients more like consumers and meeting them where they are, providing consumer choice, and allowing them a wide variety of ways that they can participate in these programs?
And now, a few words from your host. I get email from listeners that want to know what I do. Hey, I'm a consultant working in 2 areas. First, multi-level consumer engagement. I provide tactics and strategies to direct engagers, such as hospitals, payers, life science, and medical technology companies, and to indirect engagers, companies that sell products, software, and services to the direct engagers. If you haven't created tactics, strategy, and partnering around engagement, don't be surprised when consumers continue to close you off. Second, I'm a heavily connected networker who strives to connect pieces that drive innovation, collaboration, and mutual benefit. Every relationship I carry across multiple healthcare industries is open for contact, conversation, and business. Everything's changing in today's healthcare, and in many ways it's become an unsettling and yet opportunistic Wild West. Reach out to me if your company would like new thought, tactics, and strategy to increase growth and profitability. And now, we're ready for the show. You're really hitting on something that I'm keen on, which is designing patient engagement into products and services. You've mentioned some of the strategies that Solera utilizes to better engage patients. If you had to maybe break it down, 1 or 2 main areas that you're seeing the pushback on in engagement, where might they be?
If you build it, they do not come. And I think it's really trying to break through the noise and mind share of an awful lot of consumer-based health and healthcare messages. So that's the biggest issue is the credibility and the ability to reach people and even have them understand that there are valuable evidence-based programs that are paid for by their health plan. So we've done a tremendous amount of A/B testing, and it's really shown us that, for instance, in the diabetes prevention program, 1 in 3 U.S. adults are at very high risk of developing diabetes. And I think about chronic disease prevention similar to recycling, right? It's hard to get people to act on something that's not an imminent threat. Either they don't think they're the 1 in 3, or they're not really interested in preventing chronic disease or something that may happen down the road, and they don't think it's going to happen to them. So what we found is it's really about the messaging for a lot of these lifestyle change programs. It's about weight loss, and it's also about free stuff. You get people's attention when you're offering things like a free Fitbit or a free scale, because it gets folks' attention and allows us to break through some of the noise relative to some of the other opportunities that they might see as a consumer. And that's how we really have to think about patients as consumers. If we can outreach on behalf of their physician, so there's a credible source that asking them or recommending these programs to them and offering free things and offering choice, that's what's allowing us to get some attention. We launched a 2-month trial with Google and a strategic partnership to see if a direct-to-consumer campaign would work. And frankly, it didn't. We just couldn't get through to consumers and just a purely direct-to-consumer play to get attention for these programs that were covered at 100% and that clearly had a perceived value in the market.
Solera right now has 13 digital partners. I'd like you to talk a little bit about why you need more than one digital partner. What's the strategy behind having multiple? And do you plan to continually grow other technology partners within your operations and your company?
That's a great question. People ask us that all the time. And back, I would say 3 or 4 years ago, we really felt we need to find the best technology partner. And then we realized very quickly as we were doing due diligence across, at that point, a much narrower market, that there were significant differences in the way that people were delivering the program, and there was an opportunity to differentiate them. And then we also saw that there were continually new market entrants. And so we made the decision that we have criteria for those digital partners to become part of our network, but then it really needed to be who was the best performing. And that the only criteria that we could really have for including or excluding people in our network was performance. That our commitment to the health plans and the payers and the industry in general is that we will have a very high performing network. So to let people into our network, they need to be financially stable because we're enrolling people in what is typically a 12-month program. They need to meet our compliance and data and privacy security requirements. They need to be able to scale. That was really important to us, that we didn't want to include technology partners that perhaps were only interested in having a class or 2 a year. They needed to be a good partner. Our network really performs as a highly functioning network, and we share best practices and we promote quality among each other and cross-pollinate experiences, and that's really important. They need to have some evidence that they work. So most of our digital partners have studies that were done in academic medical centers that showed evidence for sustained engagement and outcomes. And then they need to be differentiated. And that's really important, is we don't want 2 digital partners that look the same. And the other reason that's interesting for us is that it lessens the risk. Most of our digital partners have a human capacity constraint because they still use a lifestyle coach. So if one partner perhaps can't scale as quickly as we need them to, we have other partners that could have coaches that we could enroll in the program. All of our digital partners provide a cellular scale. And we had a recent incident where it was literally the slow boat from China on an order of cellular digital scales. But we had a few digital partners that had an inventory of scales and others that were completely out. And so we preferentially sent those members enrolling in the program to those digital providers that had scales and inventory. So fundamentally, we're looking at who is widely successful across a diverse population, and then who are perhaps niche players that do extremely well in a smaller population. So for instance, one of our partners is Gain Life, and they have a program called Man Up, specifically focused on men. And traditionally, these programs have reached a female, older, middle-aged audience, and those are not typically the demographic that are high risk for chronic disease. It tends to be, culturally diverse men and women. And so we really looked at our network as the opportunity to raise all boats and have the opportunity to successfully match people with our programs that are going to be most successful.
Really love the fact that you have true partnering going on in your network. Tell us a bit about the Solero Platform and maybe a bit about your patented technology that you have within the company.
We have a patent pending on our business model of connecting disparate, fragmented community resources integrated into a network and as a partner to healthcare. But we also have a patent pending on our technology and our matching logic. And we've looked at it as how are we using data input traditionally used as specific marketing tools, things like health behaviors, psychographics, demographic, comorbid conditions, all of those factors, and using them to create algorithms around best matching patients to programs based on our continuous analytics and machine learning around which programs are doing better for whom. Because if you think about consumers in general, or even a health plan population, is an extremely diverse population. So our analytics are looking at how are we creating specific homogeneous subsegments of a very broad heterogeneous population and seeing what is moving the needle on behavior change for those populations. And that's the opportunity that Solera has with our technology is, yes, we can match people with programs, but more importantly, can we better understand what's moving the needle on behavior change for very specific groups and target them and do less of what's not working and more of what is working and not have a one-size-fits-all? We already know one-size-fits-all doesn't work, and because we have so many different types of interventions and so many different types of organizations delivering these programs, we have a very interesting view from a data analytics perspective of being able to analyze consumer behavior.
The ACA programs that were enacted under President Obama contain provisions to pay for preventative programs, which Solera Health taps into through the payers. And we know that the Trump presidency is not going to continue forward with a fair number of the Obamacare provisions. And that's yet to be determined, but we know there's going to be change. If you could, Brenda, take our audience through maybe what Solera is looking at with this change, or maybe anticipating, and what their strategy might be towards working with that.
Over the last 6 years, the evidence for the diabetes prevention program and other chronic disease self-management programs has just been so strong that as the market moves from fee for volume to fee for value, there's a recognition that it's much less expensive to prevent chronic disease than it is to manage it. And the DPP has also proven the value of a high access, lower cost community network as a model well beyond diabetes prevention. So regardless of what happens with the ACA, I think the horse has left the barn relative to the recognition of the importance for chronic disease prevention, especially in value-based markets. And that model has wide bipartisan support. So we don't see a huge impact relative to the diabetes prevention program or some of these others prevention programs and chronic disease management programs. There's a strong recognition that 75 to 80% of healthcare costs are related to chronic diseases, and a tremendous amount of attention on diabetes and cardiovascular disease. The new administration and the industry in general are looking for high impact and high outcomes programs that can move the needle on behavior change and the improved quality and cost associated with chronic conditions.
And largely based on the numbers you cited, about 75% of all healthcare costs go into chronic disease, I do think that as a part of not just Solera's outreach, but other companies, let's say in the care management, population health space, it's going to be really important to drive volume and not pay on volume, but drive more people into this system. We're not just needing to get people who are active people in the health system that have been to the hospital in the last 2 years or their doctor in the last 2 years, but people who might have not been to a doctor in 5 years, maybe 10 years, and they're in pre-chronic state. So they might be in a chronic state of diabetes, but have no symptoms whatsoever. And their first visit might be a heart attack or might be paralysis down a leg. And at the end of the day, I saw this when I was in practice for a couple decades, that people wait so long to go to the doctor, even more so now because of cost of care.
The documentation and the outcomes and literature are just very, very clear around the intersection and importance of social determinants of health and health behaviors and health costs. So the opportunity Solera has is really intervening early when patients are at risk for social services and behavioral health before they're in crisis, because those patients in crisis are going to show up in an ER. And in a lot of instances, I always say that healthcare bears the burden of cost of a lot of things that have nothing to do with healthcare. So how can we utilize this high access, low cost, integrated community network to help patients in a whole person approach integrate social services, lifestyle change, behavior change program, and behavioral health in a whole person approach in the community. And that's really, I think, the value of Solera as a community care coordination and integration platform moving forward.
Solera is a private company that's venture funded, and I know there's some pride that you have in that particular story. I'd like you to tell us a little bit more about that, if you could.
Yeah, I think the pride is, I was trying to bootstrap this company based on excess revenue and cash from the previous business, and really, as we were pivoting into Solera's model, realized I just couldn't run two businesses that were very different businesses. So I went out and looked for venture capital. We were raising our Series A, and we were funded by the first company we ever spoke to. We have raised $12 million in venture funding, and our investors include Blue Cross Blue Shield Venture Partners, which are 23 Blue Cross Blue Shield plans, Sandbox Industries, the manager of that fund, and SJF Ventures, which is a social impact fund. So we have phenomenal strategic partners as investors, and I really enjoy the different perspectives that those investors bring. I think they're really complementary and great partners to Solera in over the last year.
So for 2017, what are your hard targets at Solera?
Yeah, we have about 30 million covered lives for the programs we have today. We'd like to at least double that by the third quarter of next year to 60 million. And our efforts are really focused on engaging as many people who are at risk for diabetes as possible and make a big impact. So trying to bump up that number of people who are engaged in these programs is our primary focus. We currently have about 50 employees. I think that number will significantly increase during 2017. But really, our number of employees doesn't have to increase proportionally with our covered lives because we don't deliver the programs. We have to continually grow our network, and that really is where we're increasing our infrastructure within Solera as a data technology and network development and management on behalf of our integrated community network.
Brenda Schmidt, an absolute privilege and pleasure to have you on. You've done a tremendous job, and we just thank you so much for making time for us here at Red Hot Healthcare.
Thanks, Steve. I really appreciate the opportunity.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.